Samaritan Medical Center is built on a legacy of caring. Since 1881, the physicians and staff of Samaritan Medical Center have been caring for the communities in and around Watertown, devotedly carrying out the mission of providing high-quality, comprehensive, safe, and compassionate health care to ensure the well-being of our citizens. Numerous achievements, healthcare advancements, and milestones have been accomplished along the way, and one of the most remarkable years occurred in 2010, which will long be remembered as one of the most significant in Samaritan's rich history. It began in October 2006 with a new leadership team in place, and after many months of intensive planning, a new strategic plan was unveiled that would shape the future of local health care and position Samaritan to become the healthcare provider of choice.
When we initiated the strategic plan back in 2006, one of the aspects of that was to develop a facility master plan. And we knew at the time there were some challenges with the building. And so when we got into that, we really realized that we had just outgrown the space that we had. We had no space left.
Though many successes have been realized as a result of this plan, 2010 was a year of incredible growth and community leadership, the effects of which will markedly improve the quality of life for North Country residents by strengthening one of its cornerstones, healthcare. From the completion of the new pavilion at the main hospital to expanding access to healthcare services in outlying communities, to stepping forward to lead a community solution to long-term care, Samaritan Medical Center's commitment to its mission is as strong today as it was when the doors first opened more than 125 years ago. It was this continuing vision of remaining on the forefront of modern healthcare that led Samaritan Medical Center to embark on a $61 million expansion and modernization project, which broke ground in 2008. The goal was to construct a modernized facility that would demonstrate Samaritan's commitment to providing the community with a healthcare system that keeps pace with today's medical technology and rising patient expectations.
We wanted to make certain that we were designing a project that met the needs of our staff. So we got groups together, groups that really worked in the areas that we were going to be designing and creating. Meeting with the architects, gaining their insight and input before we actually designed it.
Soon it would become a project that the entire community came together to support.
If there was ever a moment when I believed that Samaritan could achieve anything, it was when I saw that community support.
Never in the history of the North Country in our area has there been a capital campaign as successful as the campaign at Samaritan. And I think that showed that the community really thinks the hospital is important.
More than 600 organizations and citizens contributed to the Samaritan Foundation's Advancing Healthcare Close to Home campaign. Local, state, and federal officials also realized the importance of the expansion and obtained grants for financial assistance to the project. In 2010, Samaritan Medical Center opened its new pavilion to patient care. This 4-story, 130,000 square foot state-of-the-art facility houses an emergency department, surgical care center, intensive and progressive care units, and a medical surgical floor.
The new pavilion, it tells the people of the North Country that Samaritan is committed to their health care, and not just the health care for today, but for generations.
This really does demonstrate to the community, yes, this is a state-of-the-art facility. They don't have to travel out of this community to get the services that they can get right here in Watertown, New York.
From the moment you set foot into Samaritan Medical Center's new pavilion, you are welcomed into a patient-centered environment. Incorporated into the new design are amenities that help make life easier for patients, their families, and our staff and physicians.
The appearance of the building itself speaks to a definite purpose and a plan, and that is very, very reassuring. It helps affirm the physician's message to the patient. The private rooms speak, I think, to the respect that we have for our patients, and they're aware of that. Their families feel that. The facility is a very impressive facility to new physicians, oftentimes coming from major university centers where they've come to expect a certain atmosphere to be present.
Samaritan Medical Center continues to enhance its patient care environment with plans to renovate and modernize 70,000 square feet of the original hospital facility. In addition, the project will include the construction of an enclosed connecting corridor linking Samaritan Keep Home with the medical center, allowing residents to be transported without the need of an ambulance. In addition to changes at Samaritan's main campus, services in outlying communities have been expanded to create a comprehensive network of community-based health centers and services.
The clinics do provide a really immediate and necessary service to those patients that live in those surrounding areas, because now they have immediate access to basic testing that they didn't before, which they may have had to travel miles and miles and miles to get to.
Located outside of the main entrance to Fort Drum, the Luray Family Health Center is the newest addition to Samaritan's growing family health network, which provides much-needed, easy-access medical services for patients in this area of Jefferson County.
When they're here and they're ill, I can order labs and get them done on the way out. And that's nice because they know their doctor will have lab results right there, but it was just one trip, one visit. For a lot of people, the younger families, that's a big deal. For the older families, that's a big deal. There's not that many people that it's not a big deal for actually to have that access right there.
It actually helps the practitioners to see more patients.
Patients also have the opportunity to access 2 outpatient testing centers at the Coffeen Street site and Washington Summit facility, as well as within the Clayton and Luray Family Health Centers. These community-based centers provide a convenient, friendly, and faster option for patients requiring lab, X-ray, or ultrasound services. – 2010 marked the beginning of a positive change and stability to long-term care. With its 40 years of experience and excellent reputation for providing long-term care services, Samaritan is also leading a local change to senior care in our community, stepping in and helping to keep the skilled nursing facility at Watertown's Mercy Center for Health Services in operation, while a community strategy was developed for a long-term solution.
That organization had been there for many, many years. It's provided care for people who needed a home, and that was their home.
And then to think that these patients may have been moved all over New York State. There weren't beds in the North Country. You know, people thought that moving meant going to Carthage or going to Messina or going to Canton. They were going to go a long ways away. What was going to happen to the families and what was going to happen to the staff that had worked so hard to take care of those patients?
When I consider why Samaritan stepped forward to take the lead with Mercy, the instant answer is why not? We're the leader of healthcare in this community. It's part of our mission.
The care that my mother's getting, there was a relief in the sense that I knew that there was competent professional management involved now. There's a very close-knit community here. The employees work very well together. There's a real esprit de corps. You can tell that they have a great deal of pride in what they do. And I think it shows through in the quality of care.
People really appreciate the fact that Samaritan has taken over, that there is stability in their lives now, that they don't have to be concerned about, am I going to be moved out or do I have to move to another area other than Watertown? That the residents are seeing the improvements that we've made, and they've noticed it in staff morale. We've gotten very positive feedback from the resident council for some of the special functions that we're doing with dietary and nursing, serving them special meals. And we've recently reactivated the music therapy program here at the facility. What we've been able to bring through the connection and affiliation with Samaritan is a sense of hope, a sense of positiveness, a sense of can-do.
Recently, Samaritan was awarded a $34 million grant to build a new senior living village to serve the aging population of the North Country and keep the residents close to their families here at home.
This grant right here was the most awarded for long-term care anywhere in the state, and that's something to be very, very proud of, and that's coming to Jefferson County. And if you look at what this solves, it solves the county's issue of wanting to get out of the adult care business. It solves bringing assisted living to Jefferson County, which is greatly needed. It's going to be a good level of care that's well needed in the community, and it's going to also solve the Mercy issue.
At the Samaritan Senior Village, we're developing 21-bed neighborhoods. And there will be 4 floors, and there will be 2 neighborhoods on each floor. Characteristics that we selected: their use of color in the design process, their use of lighting, not a lot of fluorescent lights, but more indirect lighting and wall sconces, and the use of lamps, that type of lighting. We are going to use carpet, not to use any dark tile in the middle of the floor because some people perceive that as being a hole. We're getting away from fixed meal times, and we're going to allow the residents to eat when they want to eat. It's going to be really nice for our patients.
It's been an incredible advancement since our healthcare services first opened more than 125 years ago, but the goal has always remained the same. Provide a caring and compassionate environment where dedicated medical professionals provide the highest level of care to those who turn to us in their time of greatest need.
Where else do you get to do a job that touches so many lives in so many meaningful ways?
Samaritan Medical Center, built on a legacy of caring.